Okay, well, good evening. Thank you to everyone joining us for tonight's presentation, Pathways to Patient Care, CNA and EMT. Reminder that this presentation is being recorded for posting later, so keep that in mind. We certainly like it for those of you who have your cameras on or who want to unmute to ask a question. We do encourage that, but again, it's up to you since this is being recorded. Tonight's two guest speakers are Kailyn Brant, Washington College class of 2001, and Emily Green, Washington College class of 2018. After both of tonight's guests give their presentations, we will have time for questions. Kailyn Brant, the 2021 recipient of the college's Pre-Allied Health Award, graduated summa cum laude in May with a B.S. in biology. A four-year member of the field hockey team, she is a finalist for the 2021 NCAA Woman of the Year Award. Congratulations on that, Kailyn. Kailyn began working as a certified nursing assistant during the spring semester of her senior year, building patient care hours for physician assistant school. She's currently working as a CNA at the University of Maryland St. Joseph Medical Center in Towson and will be applying to PA programs in the summer of 2022. Emily Green completed the 3-2 dual degree nursing program with University of Maryland School of Nursing, earning her B.S. in biology from Washington College in 2018 and her B.S.N. from the University of Maryland in 2019. She's currently pursuing her Doctor of Nursing practice degree from the University of Washington to become a pediatric nurse practitioner and is also working part-time as a lactation nurse. While completing her undergraduate studies, Emily volunteered over 600 hours as an emergency medical technician. Kailyn, Emily, thank you for joining us tonight. We're going to hop right into it. Kailyn, so let's start with you. Take it away.
Yeah. Hi, everyone. Thanks for having me. I'm super excited to be here. So yes, I graduated this past spring and played field hockey all 4 years, which I enjoyed. And then kind of last summer, when I found out we weren't going to have a traditional fall season, I kind of went and looked at what my sort of like career options are, what I need to get done before graduating. And I decided that I wanted to pursue PA school. And so I decided to get my CNA license in the fall, and our practice schedule actually enabled me to do that, which was really nice. And then started working in February of 2021. And I worked until, I guess that would have been June after graduation. I split my time between Chestertown, and then I also went to Easton and worked as a CNA there. And then now I'm back home. Just started my job in July at St. Joe's in Towson. And I'm currently working on a cardiac step-down unit. So we're taking care of all the open heart patients, all the TAVR patients, any stent patients. And any really telemetry or cardiac monitoring, anything that involves that. And so far I've enjoyed it. You know, it's not for everyone. There are certain aspects of the job that are difficult, and I'm sure Emily can attest to that as a nurse too. But it's been good, just trying to gain patient experience before I apply to PA school this coming spring, summer. So I'm looking at about a minimum of 200 or 800 patient hours before I can even apply to some of the schools that I'm looking at. So this is really why I'm here, to try to get you all some hours if you think you're going on the PA route. That's something that a lot of schools look for. Some don't require any patient care hours, and then some require, over 1,000. So depending on the school that you apply to, they want to see that you've worked in some type of healthcare, whether that be CNA, EMT, medical assisting, something before you go to PA school, just because it's a 2-year route as opposed to like a medical school, which is a 4-year route. They want you to have some experience coming in so they can teach you the most important stuff while you just have those 2 years there. So I'm obviously going to talk most about like preparing for PA school in the realm of, getting those hours, but be happy to talk to a little bit of kind of like how to get into nursing after that. I know I'm not the expert, but I definitely know some bits and pieces when it comes to how nursing students like do CNA work, CNI work, sort of things like that. So yeah, I'm just happy to answer questions and hopefully be helpful in some sort of way.
Thank you, Kailyn. Emily, can you tell us about your journey in terms of when you started doing the EMT work.
Sure. So I started the EMT stuff before I even started at Washington College. I knew I wanted to go into the health professions. I was on the 3 and 2 track. That's how I had applied to Washington College, but I wasn't totally sure. The nice thing about the EMT is that you know you're going to get an exposure to kind of all the subspecialties. You're going to see geriatrics, you're going to see trauma, you're going to see peds and OB. So that's why I picked the EMT because, you know, if your first pediatric emergency, you might say, wow, this is great, this is what I want to do. Or you might just say, never again, I never want to see a sick kid again. So that's why I chose the EMT path specifically. It's great because in Maryland, especially, a lot of the rescue squads will pay for your training. And then there is a ton of opportunity for advancement. So you can go all the way up to the paramedic level with some of the rescue squads. And they drill weekly. You're practicing patient care scenarios. There's tons of opportunity to get volunteer hours out in the community as well. So like blood pressure screenings, fundraising. I started the training to be a CPR instructor to get my AHA certification to teach CPR, to teach Stop the Bleed. What else did I do? I ran like a junior members program. So I taught high school kids about EMS and healthcare. And I kind of designed a curriculum for that. So the EMT definitely gives you opportunity beyond just riding on the ambulance. And then once I was in nursing school, I was also able to work in the ER in addition to the ambulance. So, you know, I think like whatever path you choose, whether it's going to be nursing or PA or PT, OT, something like that, you're going to have to change your mental model. Like it's not going to be the same way of thinking as a CNA or an EMT, but you're going to have this muscle memory for a lot of things. Like you're going to know how to talk to patients and families and ask hard questions and take vital signs and things like that. So I think the EMT kind of sets you up. So the learning curve that's going to be really steep, you kind of already know the basics. And it definitely, having the EMT definitely set me apart while I was in school. And I wound up getting an internship while I was in nursing school that ultimately set me up for my job. So even though as a nurse, you don't necessarily need 500 or 800 or, you know, whatever it is, patient care hours before you apply, I think it just does wonders for you and will set you apart.
Thanks. I'm sure that the students joining us have some questions. I have a couple off the top of my head that from both of you speaking that I'm interested in knowing. Where, like Emily, you mentioned about how the rescue squads will often can pay for your training. Can you talk about how that worked for you? And then the same thing, Kailyn, you mentioned getting your license last year, but can you talk about what that involved, where you did it? I think our students are probably interested in hearing those details and how they can go about doing the same thing.
Yeah, so I did it up in Connecticut, but I know that there are rescue squads in Maryland as well. You reach out to them and you say, I'm interested in being an EMT, and there's quite an extensive application interview process. It takes a good month or two. You do ride time, you do an interview with the board, and you write essays. You kind of have to demonstrate your interest and your skills a little bit, and then they take you on as a probationary member, and you get to ride along on the ambulance while you're taking your EMT course. So you're getting training while you're still in school. And then, yeah, they pay for your training, and they pay for you to sit for your boards. And then they take you on as a full volunteer. And I know that the rescue squad down the street from, at least when I was there, down the street from Washington, they're happy to take students, and they're kind of a little bit lenient because they know students aren't there year round. So usually there's like a 1 night a week commitment, but the rescue squad in Chestertown is pretty lenient with that for students.
So as far as how I went about getting my CNA license, I took a class through a community college by my house. Luckily it was mostly online, so and like asynchronous stuff, so I was able to do it pretty easily. I think it was like can't even think, maybe like a 8-week course sort of thing. So it in terms of like getting some sort of healthcare license quickly, it was definitely the fastest that you could do. Of course, you're not doing, I would say, as much as like an EMT. There's a lot more training that goes into that. But for me, it counted as patient hours. So went ahead and did it, did the class, and then I just had to do like 2 days of clinicals, where we like practiced on each other and dummies, taking vital signs, temperature, measuring stuff, all sorts of things like that. And then it, as long as you like just passed the class, you submitted for your license through the Maryland Board of Nursing. And unfortunately, that was the longest part about it. It took a while to get my license. So that's why I didn't start working until February. But yeah, they're normally, any community college will run those courses. I did learn that you really have to like call them in order to figure out what the class schedule is if you're not like a currently enrolled student. So you have to either email someone or call them, just say, hey, I'm looking to take a CNA course. What are the times for the classes this semester or something? And they're usually pretty good about getting back to you, at least my school was. So I know, I think Chesapeake College will run courses, Anne Arundel Community College, some others, even like Cecil County, where it's really wherever you live, you could probably find a course. But yeah, it was fairly easy as far as like the application process. I didn't have to write any essays or anything like that. But yeah, so yeah, pretty quick, but just make sure you call because you won't usually find that information online.
Okay, does anyone have any other questions? You can either just go ahead and ask. I think we're a small enough group. You can jump in on the mic if you want, and if not, you can certainly type it in the chat box as well.
For Emily, do you think doing EMT work would be like a good way to come into contact with people who you could shadow if you're looking for shadowing?
Yeah, absolutely. Because you're interacting with people both on the EMS side of things, but also you get your medical control through a local hospital usually. So I was interacting with docs and nurses. I did a ton of shadowing. I had opportunities from I was even able to, I never end up doing it, but I could have done like a flight nursing shadowing, shadowing in the ER, things like that. So it's also a good, like once you have that certification, it kind of gives you some legitimacy. So it's good for networking and then also saying, hey, like, you know, I'm not just some pre-health student, I have this certification. And
Kailyn, what was your, well, what has been, since you're still in it, what's your experience been like in terms of, obviously you're working with other healthcare professionals, and I'm assuming you've sort of expressed your interest to them in terms of going to PA school. Has there been, I'm sure there has, was sort of a leading question, but have you been able to have sort of those conversations, or, you know, sort of gaining that additional knowledge from the providers that you've been working with?
Yeah, absolutely. And I got really lucky, I would say. So the unit that I'm working on, like I said, it's a cardiac unit. And so we deal with all any type of cardiac surgery. And so how it usually works is your surgeon is the attending for all of your patients. But then they have PAs and nurse practitioners who will kind of function as the provider who sees the patient every day, who's writing all their medication orders and everything. They also do things like when you have your chest tubes in, they'll take those chest tubes out after surgery. And then they also have like temporary pacer wires that our patients come out with after surgery, and they pull those. So I've been able to interact with a lot of PAs, which I'm super, super fortunate to be able to do, and nurse practitioners, even though they function very, you know, have very similar roles on this unit. So yes, I've expressed interest in shadowing and have been able to talk to them, which is good for me. But then I will also say that I have been able to work alongside, I mean, dozens of nurses, which has been fantastic. Also have been able to talk to physicians, PT, OT, nutritionalists, which has been really great. I think even if you aren't like interested in becoming a PA, a physician, a nurse practitioner, all that stuff, I think CNA is a great way to get exposure to PT, OT, nutritionalists, just some of those other pre-health or allied health professions, and see how they function in a healthcare environment, because that's a little different. Like an inpatient environment is very different from an outpatient environment. You usually are having sicker patients, having to get them up in like from the standpoint of like a PT, OT, you're dealing with some sicker patients who aren't able to get up as easily, or you're just going to have to do more works with them. So it's been great to see how everyone within the healthcare team functions and to be part of that team. Everyone's constantly exchanging information and, helping each other out. So it's been good just to have an appreciation for all the professions. So I think going the PA route will definitely, I'm glad that I have this appreciation going into it. I think that'll make me very marketable in understanding.
So I see Dr. Yost has asked a question in the chat, and this is a great question. Do you have any advice for current students on how to balance the shadowing and potentially CNA EMT work with classes and their extracurriculars?
I can go first, I guess. So yeah, this is going to be, it's difficult to balance it, but it's possible. Like I said, I got really lucky where I did not have a traditional field hockey season, so I was able to take time and work about 1 to 2 days a week, which was nice, like 8-hour shifts sort of thing, on the weekends or whatever. As far as like balancing, if you get lucky enough to not have class on one day, you could do an 8-hour shift or a 12-hour shift if you're feeling ambitious. But I mean, I think it's really just time management comes down to it, making some sacrifices, knowing that you might not be able to kind of relax for that evening, maybe, try to get some homework done so you're able to, not worry about it while you're working, sort of thing. Yeah, I think, yeah, just time management, unfortunately. I don't know if I have any like exact advice.
Yeah, I think summer break is a great opportunity too. I did a lot of my volunteering during summer break.
Did you, well, obviously I think for you, Emily, it's pretty apparent if you were mostly doing it in the summer, but you mentioned also the local rescue squad, at least from your understanding, was understood student schedules. And so both for you and Kailyn, has it been your experience that there is that opportunity for undergraduate students, that there will be an understanding that no, you're not necessarily be coming in and be able to do this, 5 days a week or 7 days a week, and have that constant availability? Has that sort of been your experience?
Yeah, absolutely. I was an ER tech while I was in school as well, working at the hospital, and they love to have students because they know that you're going to graduate and be a healthcare provider and know that hospital system really well. And usually they're pretty excited to have somebody in the pipeline who they can hire when you graduate.
Yeah, I would say Chestertown and Easton were very supportive of any help that they could get. I mean, a couple shifts I worked in Chestertown, I remember like the nurses saying like, "Oh, thank you so much for your help today." And I was confused. I was like, "What do you mean?" And I realized that some days they don't have a CNA, they don't have a tech to work. So really they're appreciative of any time that you can give. And it works out for the student too, because they, you're getting those hours. Plus they know that you're going to be disciplined and hardworking if you're, doing extra. So yeah, I agree with Emily. They love having students and the extra help whenever they can get it. and they are understanding that you're going to have to do weekend shifts or Friday night shifts or things like that. But I mean, from what I have seen, they always need someone, especially Easton, just because that's a bigger hospital. That was just my experience, though. That's everywhere too. You're in constant need of people. If it's not like, I know if it's not on my specific unit, there's always help needed elsewhere in the hospital. So
Are there,
What kind of prior, oh, sorry.
no, go ahead, Jack. I was just going to ask if there were any other questions. So go ahead.
What kind of prior experience was expected of you when you applied to be a CNA and also an EMT?
mine's probably going to be a little shorter because I didn't really need any prior experience. I just sort of expressed interest, and because like CNA's Texas, it's a very like entry level position and there's not a lot of schooling required. I think, I mean, yeah, I didn't I didn't need much. It's a fairly fast program. EMT, you might need a little bit more. It sounds like you need a little bit more just because, well, maybe you needed a little more like with your essays or something.
Yeah, I think if you're going to go the route of being trained by a rescue squad, you just there's definitely a focus on, because I did the CNA as well. And in the EMS and fire community, there's like this focus on discipline and professionalism. So there's no real prerequisites. I think it's just a little bit more. If you're going to ask for them to pay for it for you, you definitely need to show that you're motivated and punctual and things like that.
Emily, Kailyn, do you have anything else you want to add? Now would be the time. Anything you want to share with our current students, whether it's about CNA, EMT, or just preparing for healthcare careers in general?
I guess I'll say, I think what I'm doing now, CNA, is, like I said earlier, a great way to see just all the healthcare professions. If you're early, like if you're a freshman, sophomore, even junior, senior, heck, if you just want to try it, like I said, it doesn't take very long. In the grand scheme of like certifications, it's not super expensive, so might as well try it. If you absolutely hate it, like I know, just kind of working in the hospital environment, I have kind of said that I probably don't ever want to be like a hospitalist PA, just because I don't think that's going to be for me. So it really lets you narrow down what you like and don't like. And sometimes what you don't like is more telling to, is more important than, finding what you do like. So might as well try it. Like I said, it's not just for people who are pursuing PA school, nursing school, NP school, whatever. You work with everyone. So it's great exposure to try to meet people, great networking. So yeah, I recommend it. Like I said, it's not for everyone. You kind of have to pay your dues. You do get some mean patients, mean family members, but luckily the good ones make up for the bad. I've had a great time just getting to know all of my patients. And it's been really sweet because people are usually pretty appreciative of the time and effort that you put into their care. So it's a great way to really get some hands-on experience and then also really spend time with patients and their families, just to see if you can see yourself doing something like that in the future.
Yeah, I don't have a whole lot to add. That was great. And I just want to put a plug in for the CNA route too, even though I'm here for the EMT side of it, because that gave me a really good set of experiences too.
I will also say that in the hospital that I'm working at now, in order to work in the ER, if you think that's something that you're interested in, you have to have your CNA license and your EMT license. I think in Chestertown, I'm not exactly sure. I knew that, I think they just require, some hospitals just require that you have the CNA, but that's something that can differ between hospitals. So if you're looking that you definitely want to be like an ER tech, maybe look into doing a little bit of both.
I had like one last minute question. Did either of you come into contact with psychiatrists as an EMT or in CNA?
Okay. Yes. So there's a lot of psych that I would say goes on just in inpatient settings, even like not on psych units. So as a CNA, you can function as what they call a sitter or like a patient care companion. So that's someone who, like some type of patient who might have some sort of mental health disorder who needs just like someone to be there so they don't like, sometimes it's for unfortunately like suicide watch. Other times it's just someone who's a little bit confused and you sit and kind of like don't let them pull out their IVs and stuff. So many times like a provider will come in and talk to the patient. So yes, I've seen psychiatrists on the floor. I've also seen like PAs and NPs who function under the psychiatrist as well. So yeah, I would say I see it up on like the inpatient units. Emily, I'm sure you've seen it in the ED because I know that is pretty prevalent nowadays too.
Yeah, I think, well, first of all, in EMS, just such a huge percentage of the calls you respond to have some kind of psychiatric component to them. And then in the ER, I was often in, like a lot of ERs have psych ERs, like subspecialty kind of areas in the ER. So I spent a lot of time in the psych ER working with psychiatrists. And then, I don't know, maybe Kailyn, you can speak to this, but a lot of hospitals that have psych hospitals affiliated with them will hire psychiatric technicians or behavior technicians. I don't know if those are CNAs. I think some of them are. So that doesn't answer your question directly, but yeah, definitely a lot of opportunity to work with psych patients.
Yeah, so I do know that, so in my hospital on our psych unit, there are CNAs who work in that department, doing basically the same thing, taking vitals, checking blood sugars, all that stuff. But then you do have that other psychological component to it. So if you're interested in it, you can definitely find, that type of environment. It's out there, even outside of like your inpatient psych units.
Thank you.
Well, I want to thank you again, both for joining us. Obviously, it's neither of you have wide open schedules, so I certainly want to express our gratitude for you being able to speak with our students this evening and for sharing all that information. And is it fair to say that if there are any further follow-up questions, I can put those students in touch with either of you?
Absolutely. I'm always happy to help. I wish I would have had someone let this sort of thing when I was, freshman, sophomore. And I will say that, like I said, Chestertown and Easton are very appreciative of any students who want to come be a CNA on their units. I do have a pretty good relationship with the nursing coordinator at Chestertown. And then also I could always reach out to my old boss who at Easton, who I worked per diem for. So if anyone's interested, once you get your CNA license, even before you get it, if you have any questions about that, definitely I'd be happy to help you with that process. But then if you get your license and you want to work in Chestertown or you're able to work in Easton as well, definitely let me know because I can try to put in a good word for you. So hopefully you can get a job.
I don't know if there are any Western Shore folks here, but I worked for the Adventist system out in Rockville, Gaithersburg area. So I have quite a few contacts over there. And then also I live in Seattle. So if anyone wants to move out to Seattle after graduation, let me know.
All right, thanks again to both of you, and thank you for those who joined us here. And that will be it for this evening. Thank you. Goodbye.